Some care workers in the UK supporting the most vulnerable people say they're running out of protective equipment for frontline staff dealing with patients during the coronavirus. They have called on the British government to provide more supplies, including face masks, gloves and hand sanitizer. With many orders diverted to the NHS, some care providers have had to ask for donations from local businesses, as our home editor Mark Easton reports.
These are our masks that we're desperate for and hoping for a supply very soon. But as I say, our mask order has been delayed.
They're down to 1 or 2 days of protective masks at this extra care home in Northampton.
Why is that? Just been outside. There we go.
Supplies of hand gel are running low too. Desperate staff fear they won't be able to protect vulnerable residents from a virus that might well kill them.
The masks that we are using, we're not sure how to prioritise. You know, who has a mask first, or which service user we go to that has a mask. So we're managing at the moment, but we don't know where our next supply would come from.
The company that runs this centre has repeatedly ordered new masks for their 2,000 carers across the UK, but suppliers have told them the protection equipment has been diverted to the NHS.
And we're really down to the bare bones now of masks and gel in terms of supplies. And we're desperate really to try and get some more equipment through quickly so our care staff can be fully protected and deliver the important service that they do.
The government says it's working around the clock to give the social care sector the equipment and support it needs. But English local authorities have written to the Health Secretary to say supplies are not reaching the front line. Councils across England are so worried about the shortage of masks for carers that they're appealing to closed nail bars, construction firms, anyone who's got supplies, to consider donating them to social services. Jamshal Ali died a few days ago after he tested positive for the virus in a London care home. Only a handful were able to attend his burial. The family say more should have been done to protect him.
Any family who has someone in a care setting really should make the effort of talking to the care home. Really should find out what measures are in place so that their loved ones are being cared for.
Here's a drink for you, love.
Ash Carby, who has Parkinson's and advanced dementia, needs carers 4 times a day at his home in North London. His wife says they arrive on public transport without masks to protect him or themselves.
They have to go within 2 metres of him, and there's no protection. They could be asymptomatic but contagious and give it to him. If he gets it, I doubt he'd survive, to be honest.
This is our dining room that has been highly...
The government says every social care provider will get the supplies they need and denies the health services being prioritised. But this is a sector that has long felt it's played second fiddle to the NHS. Mark Easton, BBC News.